Good morning, friends. I am very happy to announce that we will be conducting a webinar on the World Cancer Day 2022. The World Cancer Day is observed on 4th of February 2023. But since 4th is a Saturday and our students will be on leave holidays, we are planning to conduct this meeting on the Monday, 6th and 7th. And I've written a formal request for permission, which has been forwarded by our HOD ma'am. And I submitted that to the dean, discussed with him today morning. And he has agreed for this. He was happy about this. So I thought I will make the first announcement for you about this meeting. And that will enable us to prepare for the meeting and participate in that successfully. What is the speciality of this CME program on the World Cancer Day week? This international CME program is divided into two parts. One, we are going to talk about current research in preventive oncology. And the second part is the future research in preventive oncology. So that is how this CMA will be divided into two parts. First one is the current research going on. And second is the future research. And what I have done is I have requested the International Agency for Research on Cancer, World Health Organization, to kindly participate in this CMA and deliver expert speech so that our students would be benefited. And also, students and faculties who have registered the previous two international conferences, they would also be benefited. We'll send them invitation to register for this upcoming international CME in commemoration with the World Cancer Day 2023. And this online conference will be on the 6th and 7th of February 2023. And how we are going to go about it, I will explain to you. On the first day, we'll be taking up the current research in preventive oncology. And that would be the cervical cancer elimination strategies and programs going on in this world, in all the countries. So, what is going on in all the countries, and how are we working towards the strategies for cervical cancer elimination? There will be an expert speech by Dr. R. Shankar Narayana, former head of the screening group of International Agency for Research on Cancer, WHO, Lyon, France. He is very well known in the field of preventive oncology. He has traveled to more than 100 countries and established cervical cancer screening programs, and he is the chief advisor now for the WHO about prevention of cervical cancer programs. And in India, he is the chief advisor for the National Health Mission in prevention of cancer. Also, he is the director of preventive oncology, Carcinos, and he is also heading the prevention oncology unit for many international organizations in India. So he'll be giving an expert speech on cervical cancer elimination strategies across the world. And to support this, there will be presentations from the ongoing IARC WHO projects in India. The first project where this cervical cancer screening program is going on is at Mmchri, Odinjatram district, Tamil Nadu, India. I was the principal investigator of this program from the beginning, that is in 2000 till 2005. And after that, I left that, and my colleagues have taken over as the PI. So one of the PI will be presenting about the progress made in the cervical cancer screening program of the IARC project in Tamil Nadu. And again, there will be a presentation from the same project regarding HPV vaccine trial. HPV vaccine trial in India is conducted only in this place. So the vaccine trial is on the way. Preliminary results are available where single dose HPV vaccine is compared with double dose HPV vaccine. And what is the result of this vaccine trial will be presented from that project. So this is only one of its kind in India who can tell about HPV vaccine trials among Indian adolescent girls. So following that, they will demonstrate how a camp is conducted in a village, a community-based cancer screening camp and HPV camp, how they are conducting that in a village setting. So these are all practical examples of the theme of WHO cervical cancer elimination by 2030. So these presentations will be in the morning, and again one more presentation of IARC project at Nargis Dutt Cancer Memorial Hospital, Barshi, Maharashtra. This hospital is a subunit of the Tata Memorial Cancer Hospital, Bombay. So there will be a presentation from the project regarding how they are conducting cervical cancer screening camps in the rural areas of Maharashtra, what are all the challenges and how they are finding solutions. So after this practical sessions, there will be a presentation from the Cancer Institute at IR. They will talk on the cancer registry for India and the cancer registry for Tamil Nadu. And they will emphasize on the point what happened to the cancer incidents, especially cervical cancer incidents, 5 years back and now. After all these programs have started, have we reduced the cancer incidence or it is not reduced? So the effect of screening programs will be taken up by the cancer registry presentation. We will have authenticated data from the authorities in Cancer Institute. So following this, the most important highlights would be a live presentation from International Agency for Research on Cancer, WHO, Lyon, France, Dr. Partha Barsu, the head of the unit of preventive medicine and infections early detection unit of IARC, would be delivering a special talk, a live. So that is the highlight of our program. And he'll be talking to us, uh, telling his strategies, and he'll be emphasizing how planning of a program is important for the success of the program. After his speech, there will be 15 minutes question and answer session. And we can always approach WHO with our own projects and apply for funding. He is one of the chiefs in WHO who can scrutinize our applications, and if it is worthy enough, they would be happy to support us to conduct that project, conduct our research. So this is a very good opportunity for faculties and students attending this webinar to apply for WHO grants and fellowships to conduct projects in their own areas. So this program, uh, this session, direct live presentation from WHO will be followed by a inauguration session from Mayor. So the Vice Chancellor, Registrar Ma'am, and other officials would be talking in this inauguration program to welcome the dignitaries from WHO and then tell their expectations from WHO. Ours is a medical university, a medical college, so we can ask for number of projects, fellowships, research grants from WHO, and if we are of that standard, then we'll be offered such grants, scholarships, fellowships, fundings. And this is again from my own experience when I was working at PSG Institute of Medical Sciences and Research, PSG Medical College, Coimbatore, where we wrote projects for the pathology department, community medicine department, obstetrics gynecology department, and we got them sanctioned. And today those projects are going on at PSG. Special projects in pathology, special outreach programs from Department of Community Medicine and colposcopy clinic, colposcopy training programs at the gynecology department. So we should try and make good use of the opportunity which will be available during these webinars when we meet the expert speakers from them. And this will be followed another two sessions from Dr. Richard, an expert in IRCWHO in screening programs. So he would be happy to deliver two talks on the importance of the screening programs and how IARC would be helping in this organization planning and funding of this. So this will be concluding uh, by 3 p.m. or 3:30 p.m. on the first day. And if there is time, we may have a presentation from Christian Medical College, Vellore, about their experience in screening programs, gynecology screening programs. That will be from the Department of Gynec Oncology, Christian Medical College, Vellore. So thus we'll be coming to an end of the first day, which dealt about the current research topic of cervical cancer, elimination strategies, human papillomavirus, vaccinations, vaccine trials in India. So we'll be concluding the sessions on the first day. And what I would request you to prepare questions on what you can talk, what you can discuss with the WHO experts who are presenting live, and how that can be useful for us to get research grants, funds from WHO or programs in our own medical college. So that will be on the first day. Hope I have explained about the first level, and now we'll go on to the second level of the CME program, that is on the day 2. On the day 2, we are going to have very special topic of future research in preventive oncology, and the title is multi-cancer early detection. That is the upcoming new research field in oncology, in preventive oncology, where they are going to tell about a single blood test which will predict 50 different cancers in their very early stages when the symptoms are not at all present. So, this is an excellent topic to know about, mainly for our knowledge purpose. We'll be uh, hearing to experts who will talk on what is this multi cancer early detection, liquid biopsy, where more than 50 cancers can be detected from a single blood sample. Now, this research is going on in UK and USA and in many other developed countries. So there will be special talks on this multi-cancer early detection research. One speech will be from WHO itself, the International Agency for Research on Cancer. They would speak on multi-cancer early detection. And that will be followed by experts from an organization called eCancer from Bristol, UK. They are pioneers in this, and they would be sharing us their knowledge and expertise regarding multi-cancer early detection. And they would tell us how blood samples are taken, from which age group, um, the, how the enrollment is made, and then how these blood samples are taken, how they are analyzed, and how they are able to predict 50 different types of cancers at the very early stage, even before symptoms occur. So this will be on the second day, a series of talks on multi-cancer early detection. And again, there will be enough opportunity for us to discuss with them. There are question and answers sessions after each speech is over. So we should be uh, having enough time to talk to them, clarify our doubts, and you can make the question answer session very useful and successful. And again, this MCED, if found successful, can be taken to the community screening with multi-cancer early detection tests. And that would be a great boon for the people even in the rural areas where we will do screening for them, do blood test for them, and find out whether they have chances for getting cancers. And what is the use of this? We can direct treatment to these very early stages of cancer and see that they don't develop the full blown cancer in their lifetime. So, this is a translational research from the lab level. Now they are doing it in bedside level with very small groups. So, in the stages of vaccine development, we have seen phase 1, phase 2, phase 3, phase 4 trials. So, like that, this MCED, multi cancer early detection test, was carried out in the laboratory as the first stage. Then it is carried on with small groups of people, second stage, and that is found successful, that we apply to the community. Once the clinical trials are found effective and successful, that will be extended to the community as community trials. So this is how we are planning to conduct the international CMA online program in commemoration with World Cancer Day 2023. And our CMA program is planned on the 6th, Monday the 6th, and Tuesday the 7th of February 2023. And we would send you the Google links for registering yourself and your organization and your friends for this online CMA. And once you get the link, kindly register. And we will be applying to the Tamil Nadu Medical Council for accreditation and credit hours. And since we'll be doing this for 2 days, we expect 4 credit hours for this CMA program. We got like that for our previous international CMA programs. One was on human papilloma virus during August 2022, and another recently conducted on rabies in August, September, October. It was in October 2022, 2 days. So these two um, international CMA programs were awarded 4 credit hours to the participants and 5 credit hours to the speakers. Therefore, for this upcoming international CME, we again expect 4 credit hours for the participants and 5 credit hours for the speakers. And if any one of you is interested in giving a speech on one of the themes in this conference, which is cervical cancer elimination, HPV vaccination, and multi-cancer early detection, you are welcome to send a message to me. What is the topic you're interested in? And we will see how we can fit that into this schedule for the international scene. Wish you all the best, and I request you to kindly cooperate and support this CME program, and thus ensuring our solidarity with the World Health Organization to eliminate cervical cancer from this world by the year 2030. That will be a great mission and a vision for us. So may God bless us and wish you the best of luck. Please expect the Google Forms and kindly register as early as possible. Thank you very much.